Okay, good. So it started. So, first of all, what we were talking about and what you saw in the videos in the case of the anatomy portion, where we had mainly we were talking about the digestive tract. And you remember that in the general consideration, we said that digestive system, this particular two words are describing the part of the digestive tract, so tube-like structure starting from the oral cavity towards the part of the anal canal. And the second thing, what also is included here, these are the accessory organs of the digestive system. And as a result, these are particularly what I said, the part of the glandular structures mostly, yes, such as salivary glands, the part of the pancreas there, as well as we do have a portion of a biliary system where we have a gallbladder with a part of the bile duct there. But let's go through and let's see what do we have here. What is important? So mainly the localization, important the vasculature, and important the innervation. Yes, in case of vasculature and innervation, it will be much easier for you. Yes, because you already know from body systems 2 and 3 the most of the blood supply of the body, as well as the innervation of the different parts of the body and the visceral organs. As a result, it will be very logical for you. Yes. So to start from a very beginning, you can see here we do have a portion of a salivary glands. And to talk about the salivary glands here, you can see that first of all, there are many salivary glands which are literally localized and dispersed through the whole oral cavity, out of which you can see particularly here, you can see three pairs, correctly to say, three pairs of the large salivary glands, which are literally multicellular large structures. And as a result, you can see here the part of the parotid gland. As you can see, we do have here the portion of the submandibular gland, as well as the portion of the sublingual gland. So out of which the parotid is the largest one, the portion of the submandibular is medium sized, and in the case of a sublingual, it's one of the smallest type of a salivary glands. Although here we need to say also and talk about the small salivary glands, which are again dispersed through the whole oral cavity. They are literally very numerous. They are small, and these are the types of a tubular salivary glands. And as a result, they are mainly located where? In the portion of epithelium, yes, because the glandular tissue itself is the epithelium. So as a result, we do have it localized in the portion of epithelium, and particularly in the case of the tongue region, where we have a small lingual type of a gland. We do have them also in the region of the buccal surface, particularly the cheeks. That's why we call them buccal type of a glands, as well as we do have a labial type of glands, meaning that they are associated with the structures which we call lips, as well as the part of the palate type or palatine type of a glands, which are also associated with the part of the palate. So to start to talk about the very first one, which you see here out of these three pairs of large type of the salivary glands, the first one and the largest one, this is the parotid, as you can see particularly here. And the parotid gland simply is called because of its localization and very close proximity to the part of the ear that is particularly is localized anteriorly to the region of the ear, as you can see here. You remember that it's a type of a serous gland, and what is important here, you can see that the parotid duct passing towards the region of the oral cavity, as you can see here, normally it passes on the lateral surface of a part of the masseter muscle. That's what you can see particularly here, as well as you can see, as it enters deeply towards the oral cavity, you see that it also traverses the part of a buccinator muscle, and then enters to the part of the oral cavity, and most commonly localized or is opening somewhere at the part of the molar teeth, particularly the upper second molar teeth, as you can see from here. This is particularly part of maxilla, and as a result, we do have it mainly on the upper part of the oral cavity, so particularly associated with the maxilla, with the second molar tooth. Now, what is interesting, the next part, what do we see here? This is the portion of the submandibular type of the of the gland that you see here. Most common, why it's called like that, I do believe it's very much understandable and clear. Yes, because the submandibula simply means below the mandible or under the mandible simply. And what is interesting here is that you can see how it looks like that here it is particularly the part of the mandible. This is the mandibular region, this one and this one, and particularly literally below the structure of a bony structure of a mandible, we can find the pairs of a submandibular gland on both of the sides. Now, what is interesting is that that particularly in the case of a submandibular gland, having the portion of the duct, as you can see particularly here, it as soon as it leaves the portion of the gland itself, you can see that it starts to pass more anteriorly, because mainly you can see here that the part of the submandibular gland is localized more posterior in the portion of the oral cavity, but its duct, as you can see, passes more anteriorly to the part of the mucosal membrane and enters to the part of the floor of the oral cavity. Oh, it's clear why I do believe, because it's a part of the submandibular gland. So according to its anatomical localization. And the most interesting thing, you can see that it opens particularly very close to the frenulum of the tongue. So to particularly this connective tissue structure, which is covered by the epithelium. And here we do have the opening of a part of the duct of the submandibular gland. So in the very close proximity to it, you can see that we do have the third pair of the large glands, although this one, the sublingual one, is the smallest. Sublingual, the same idea of the naming, that as it was in the case of sublingual, yeah, as it was in the case of submandibular. So the submandibular was below the mandible. I do believe it's clear that the sublingual will be particularly localized below the portion of the tongue. Now, what is interesting here is that how it is simply localized and where do we have it. So, and you can see here that particularly it is localized directly on the floor of the oral cavity, and particularly all of these three main type of salivary glands, they are associated with the formation of a saliva, and as we know, approximately up to 1,500 grams or milligrams to, or milliliters to correctly to say, of the saliva is literally produced per day. So sure, up to, because it is dependent on what type of the food intake we had this day, and according to what type of the irritants we had, and so on. For example, in the case of the sour type of the taste, you know that it is increasing the part of a salivation. Yes, the more texture, for example, such as more soft type of a texture, it's also increasing the salivation. Vice versa, in the case of the more dry and more, for example, a hard type of the structures are vice versa decreasing the salivation. Although when we talk about that, sure, logically we can continue with a part of the regulation. Although third part of physiology, it is already clear what type of the regulation do we have here, but it's important in case of anatomy to remember simply what are mainly the type of nerves which are giving rise to the regulation of the salivatory function of the glands. And here comes the idea that you remember very well that it's a part of the involuntary type of innervation, and as a result we talk about the parasympathetic and the sympathetic type of the regulation. And in the case of the parasympathetic, I do believe you remember it very well, that in this case we do have particularly two types of the cranial nerves mainly, and these are the seventh cranial nerve, which is facial type of the, that's true, Judd, thank you so much. This is the seventh or facial cranial nerve, as well as we do have the cranial nerve 9, which is the glossopharyngeal. So they are mainly the ones which are giving us the innervation, and particularly here you remember that in the part of the brainstem, because these are two types of the cranial nerves out of 9 pairs of cranial nerves which are associated with the brainstem. Yes, as a result, in this case, the nuclei which are parasympathetic nuclei, sure. That's what we call the salivary nuclei. They are particularly, or salivatory nuclei, they are the ones which are associated with a part of the brain stem. And as a result, we do have the portion of the cranial nerve 7 and the cranial nerve 9, which are not which are not correct to say, but because it's the mixed type of a nerve. So to say correctly, their parts or the portion of their axons are originating from this particular salivary type of a nuclei. Now, what is also interesting here is that we remember that also the cortical innervation here is important, although the main idea how this everything is happening, and in this case, the idea here is that anatomically we do have a cranial nerve 7 and a cranial nerve 9, which are mainly helping us to regulate the type of the salivation. So when we continue in this case, so the part of the salivary gland, okay, this one was said and this one was said. Okay, the next portion, what we see here is the part of the pancreas. And in the case of the pancreas, what do we have is that it's also a gland, yes. But in this case, we do have, you remember that it mainly has the two types of the secretions. This is exocrine, endocrine. I will not stop here to talk about that because we'll talk about that in the case of the physiology. But anatomically, what is the most important for us is that what are the main parts of the pancreas? And here you can see particularly the part of the regions of the pancreas. That's how they look like. This is the regions of the pancreas, so the part of the head, neck, body, and tail, as you can see here. And the interesting portion is that this particular structure, this particular organ, is passing the midline. So it is with its head portion, as you can see, particularly here in some part of the neck. It is more localized in the case of the right side of the abdominal cavity, and in the portion of the body and tail, it is localized more in the left side of the abdominal cavity. That is important to remember here. Now, to start to talk about the head, that's what you can see here and even here. So the portion of the head is really interesting because, first of all, it's most expanded part of the whole pancreas, as you can see particularly here. And from this nice picture, you can see that it is surrounded by the duodenum, by the C-shaped duodenum, as you can see particularly here. What is interesting is that this particular what are the parts of the duodenum? Yes, if you remember, we were talking about the parts of the duodenum, and particularly we had there the portion of the, for example, superior one, yes, or the first part, and we had the descending part and the horizontal. So particularly, as you can see here, the part of a descending and a horizontal portions of the duodenum are the ones which are in the very close proximity, localized to the part of the pancreas. Now, according to this picture, it's not seen well, but you can see that the head has the projection, which we call the uncinate process. That's how it looks like here. Schematically, sure, they just show you that it is there, although this is how it looks like in this particular picture. So this is the part of the uncinate process, this one, or here. This is the part of the head. You can see that we can even subdivide the whole head into two parts. One is the head proper, as you can see, and the second one is a portion of the uncinate process, as you can see particularly here. So uncinate process is simply a projection from the inferior surface or inferior part of the head of the pancreas, okay? And what is the most interesting, and it's seen better back again in this picture, you can see that from the anterior surface, it is not seen. Why? Because it is passing and it is lying posteriorly to the SMA, or the superior mesenteric artery. That's what you can see particularly here. Now, itself, just a second, let me recheck the picture, which will be easier to show. Yeah, this one. This is the good picture, which shows you the part of a pancreas, as you can see particularly here. And what is the most interesting, that itself, the head of the pancreas, as you can see, it is localized also in the very close proximity to the part of the inferior vena cava. That's what you can see particularly here. This is the inferior vena cava, how it is passing. As a result, we can say that the head is literally residing on the part of the inferior, inferior vena cava on its posterior surface. as you can see, as well as we do have a portion of the, as you can see here, the part of the kidney. Yes, that's how it looks like, although itself the kidney is not in that close proximity and proximity anatomically. But I do believe it's clear, and you remember from the previous semester that the part of the kidney is supplied by the renal arteries, yes, as you remember, which are mainly originating from the abdominal aorta on its lateral sides, yes. So as a result, from the part of the abdominal aorta, we do have the renal arteries, particularly the right renal artery, because we talk about the head, as you remember. So the right renal artery, as well as the right renal vein here, and some portion of the left renal vein here is also will be associated with a part of the head posteriorly. Now you will say, okay, the part of the right ones, the right renal artery as well as the right renal vein are clear why they are in a close proximity to the part of the head of the pancreas, yes, but why the left one? But you remember again from the previous semester information that when we're talking about the inferior vena cava and its tributaries, yes, the renal, like the idea of how the abdominal aorta and a part of the inferior vena cava are localized, yes, they are very parallel to each other. They are very closely localized to each other. But if you remember, the portion of inferior vena cava is more lateralized and localized on the right side of the abdominal um, of the abdominal cavity. And in the case of the aorta, as you remember, it is having more it is, as it is passing down, it is more let's like that moved towards the left side. And as a result, for example, if we'll compare the part of the arteries and the veins in this case, yes, the portion of the left renal artery will be a little bit shorter, just because of the closer localization to the part of the aorta. But the part of the left renal vein needs to be a little bit longer. Why? Because to simply reach the more laterally and on the right side of the abdominal cavity localized inferior vena cava. That's why the head here will have a small still connection with the part of the left renal vein. Okay, did you understand what I said till now, or you want to ask me something, guys? Was that part clear, or you have any? So yes, it was clear. Yeah. Okay, that's good. That's good. All right. To continue here to talk about the part of the pancreas. So going back, we do have here the neck and the body. So although what is also interesting in this case, this portion here, yeah. Yeah, because I forgot to talk about more about some general information about the portion of the pancreas, as you can see, where it is localized, and I just started directly to talk about it. So this picture as well as this picture are very much important for us. And why? So particularly because first of all, it's, I mean, the general localization, yes, of the pancreas, where we can find it. Although, yes, we said that it is mainly associated with the right, both the right and the left side of the abdominal cavities, as you can see, abdominal cavity, as you can see, particularly here. But what is also important and to talk about this is what type or what anatomical reference it has to the part of the peritoneum. This is important to remember. And as well as particularly at what level of the vertebrae it is residing. And as you can see, particularly here from that picture, it's not that very well seen, but still it is mainly localized somewhere at the level of the L1 and L2 regions, on the and closer to the part of the posterior abdominal wall. Because if we talk about the tract and accessory organs, you remember that in the case of the stomach, when we're talking about, yes, this particular region, I mean the portion of the stomach there, was covered by the peritoneal lining, and we had particularly the formation of the formation of the lesser omentum and the greater omentum, as you remember. And particularly, as you can see here, the part of the whole pancreas is literally covered by the portion of the greater omentum, although it's not covered from all of the sides. Yes, as a result, we cannot say that this is the intraperitoneal type of the organ. As a result, it's only the retroperitoneal type of the organ, so which is localized at the level of the L1 to level between the level of the L1 and L2 vertebrae particularly. So what is also interesting is that particularly the part of the colon, the transverse colon, has a very close proximity, as you can see, particularly here, to the, so anatomically, to the part of the pancreas. Now, continuing to talk about the pancreatic part themselves, so we said about the portion of the head. Now, what about the neck itself? First of all, the neck portion is much smaller type of a structure. It's approximately 1.5 to 2 centimeters only. And that's what you can see particularly here back again. That's how it looks like. So the portion of the neck. So literally the head is continuous by the part of the neck, as you can see here, and then continues by the part of the body as well as the portion of the tail. Now, in the case of a neck portion, what do we need to remember here is that particularly its anatomical reference again, yes? So as a result, because we know that the pancreas is simply located posteriorly to the part of the stomach, particularly the portion of the pylorus of the stomach is associated with the anterior surface of the neck of a pancreas. And again, to say it understandably, that because the pancreas is simply localized on the posterior surface, yes, of the stomach, and particularly here, because you remember that the head of the pancreas, yes, as we saw in this particular picture, the head of the pancreas was literally surrounded by the portion of the duodenum, yes. So as a result, in the portion of the neck, which is more localized more medially in this case, so closer to the portion of the stomach, we can see that particularly the part of a pylorus of the stomach will be associated with a portion of the neck, okay? As well as what you can see particularly here is that particularly behind or posteriorly to the part of the neck, we do have the formation of the hepatic portal vein. Do you remember hepatic portal vein? So how? With the help of a portion of the splenic vein as well as the superior mesenteric vein. Do you see? So the splenic vein portion and the superior mesenteric vein are merging to each other to produce the part of the hepatic portal vein, literally on the posterior surface of the neck of the pancreas. Okay? Is that clear till now? Good. Now, the portion of the body of the pancreas that we have seen particularly here, as you can see, it's simply continuous. I mean, the neck continues by the body here. And in this case, we do have that it literally crosses the part of the abdominal aorta, as you can see here. And particularly, it is localized somewhere at the level of the L2 of the vertebra. What is interesting in this case is that particularly these regions of the body, which is seen here, as you can see, so this is mainly the body of the pancreas. So what is happening with a part of the body of the pancreas? That particularly its anterior surface, okay, as you can see, is covered by the portion of the peritoneum, yes, as we said, okay, as well as the part of the portion of the greater omentum, which is starting here, as you can see here. So it is in the very proximity to the part of the body of the pancreas particularly, okay? Now, what is interesting, according to its localization and referring to the large type of the blood vessels here, so besides to the aorta, sure, you can see that particularly the second anterior unpaired type of branch of the abdominal aorta, which is the represented by the superior mesenteric artery. Why I said all of this, because it is just, I want you to imagine that, okay? That the part of the anterior surface of the aorta, you remember that we have the anterior unbranched type of the, unpaired type of the unpaired type of a branches, and the first one was the portion of a celiac trunk, but the second one, approximately immediately below the or inferiorly to the part of a celiac trunk, we do have the formation of the superior mesenteric artery. Yes. As a result, the body has the association with a part of the sure itself, the abdominal aorta, as well as the superior mesenteric artery. And here, interesting thing is that because the body crosses towards the left side of the abdominal cavity, as you can see particularly here, it is associated with a part of the left suprarenal gland, as you can see here, as well as the part of the medial part of the left kidney, and sure, the part of the renal artery and vein, because in both of the cases here you do have a part of the renal artery and part of the renal vein, although they are not the ones which are giving blood supply to the part of the pancreas, and we will talk a little bit later about that. It's just the anatomical reference, nothing else. Okay, so just to see it better, yeah, here it is seen very well. So the portion of the how do you call it, the part of the body here, as you can see, so associated with a part of the superior mesenteric artery, the part of the aorta itself, as you can see here, although unfortunately the parts of the renal vessels are not seen here well, but that's okay. Now, the next portion, what is left here to talk about, this is the part of the tail. So this is the portion of the tail of a small piece of it, let's say like that. And as you can see how closely it is associated with a part of the left kidney. So it lies simply on the anterior surface of the left kidney, as you can see here. And because itself, like as the tail is the continuation of the part of the body, so it moves from the more medial part of the abdominal cavity towards the lateral. As a result, the part of the tail also will be in the close proximity to the part of the spleen, as you can see here, as well as particularly its hilum. Do you remember what was the hilum? Particularly the entrance, let's like that, of all of the blood vessels, and then the part of the veins which are living are simply having like a door, like the entrance, and this is particularly what we call the portion of the hilum. So as a result, as it passes more from medial side towards the lateral side here towards the left side, that's why we do have the close proximity to the part of the hilum of the spleen, as well as in the portion, if you remember, the part of the spleen on its anterior surface internal surface had the surface of the for the how do we call it? That's where we had the part of the left colic flexure. Do you remember the colic flexures which we talked about, which were produced as a part of the simply a turn of the ascending colon to the transverse colon? That was the formation of the right colic flexure, and where the transverse colon is converted to the descending colon, so this particular turn is the left colic flexure. As a result, the left colic flexure here has the association with a part of the tail of the pancreas, as well as the portion of the spleen, and sure, the part of the left kidney. Now, what is also interesting here is that, particularly from that picture, you can see that how the tail is literally embedded into the part of the ligaments of the spleen, or splenic ligaments here. So you can see particularly part of the splenorenal type of a ligament, how it is embedding. I mean, the tail of the pancreas is embedding into this portion. Now, what is interesting to say here is that why do we need itself the pancreas? We said, okay, it's a type of a gland, and as a result, it will, because it's a mixed type of a gland containing the part of exocrine and endocrine type of the secretions, means that the part of the exocrine portion, yes, here this acinite should be containing the portion of the ducts, simply, yes. So as a result, anatomically for us, it's important that we do have most commonly two pancreatic ducts, and one of them, as you can see particularly here, this is the main pancreatic duct, how it passes towards the portion of the duodenum, and also we do have a portion of the accessory pancreatic duct, as you can see here. Now, what is interesting for us in this case is that uh, um, the part of the pancreatic duct, the main pancreatic duct I'm talking about, as well as you remember that the portion of the bile duct, as you know, they are merging to each other most commonly, again, not always, approximately up to 25%. We do have some anatomical variations when particularly the part of the a pancreatic duct and the portion of a bile duct may be entering to and opening into the portion of a duodenum separately and not simply merging and producing one entrance. Okay, as a result, what we see particularly here, that how they are passing through it, that and most commonly when we do have the merging of these two particular ducts at the entrance to the portion of the duodenum, that's where particularly we call this particular region, which is a little bit larger. It is very well seen here, as you can see, particularly on this portion. Do you see? So here we have a bile duct. Here we do have a part of the main pancreatic duct, and as a result, they do have the formation of the larger and more like thicker and dilated type of the structure. That is particularly what we call the hepatopancreatic ampulla. And hepatopancreatic ampulla, as you can see particularly here, is entering towards the duodenum at the level of the through the entrance, which we call the major duodenal papilla, as you remember. Now, so as a result, simply to say, most commonly the main pancreatic duct anatomically will be merging with the part of a bile duct at the particularly immediately before entering towards the and emptying towards the part of the duodenum. And this larger, dilated but short type of the structure, that's what we call particularly pancreatic ampulla, or we also know it as the ampulla of Vater. Now, what is interesting in this case is that sure, every and each of the duct themselves, as you can see particularly here in the part of the bile duct, in the part of the main pancreatic duct, as you can see, as well as you can see that itself, the portion of the pancreatic ampulla, all of them contain the layers of the smooth muscle cells, and particularly the ones which are producing the sphincters. So here you can see the part of the sphincter of the bile duct, which is literally surrounding the terminal portion of the bile duct. Here you can see the sphincter of the pancreatic duct, which is mainly surrounding the terminal part of the pancreatic duct, and as you can see particularly here, the portion of the hepatopancreatic type of the sphincter, or also known as sphincter of OD. Please remember that particular names because they are important in the case of the anatomical information. Now, as you can see, sure, again and again, as I said, we do have a portion of the smooth muscle cells here. Yes, so the smooth muscle region. And as a result, we do have the passage of the part of the bile as well as the pancreatic juice towards the portion of the ampulla and then towards the part of the duodenum. Although, as any type of it's not an exception, but like it's the anatomical variation. As I told you, up to 25% of the cases of the individuals may have separate bile and the pancreatic duct, which is really very interesting. And as well as we also have additional type of the pancreatic duct, which we call the accessory pancreatic duct. As you can see particularly here, it also empties towards the portion of the duodenum. But in this case, although it's not seen here very well, but here it should be. Yeah, here it should be this portion, although it's not seen, but just a sec. Okay, so here particularly this opening, we call it the minor duodenal papilla. So if you remember here, we had in the case of the portion of the hepatopancreatic ampulla as it was opening into the major duodenal papilla. Here we do have a minor duodenal papilla, much smaller structure in this case, although it's still the opening of the accessory pancreatic duct here. Now, Also, the idea here is that particularly this accessory pancreatic duct, as you can see, is literally simply having the merging with the main pancreatic duct, as you can see particularly here. And sometimes happens again, and as a part of the anatomical variation, we can see that the part of the main pancreatic duct is smaller, like in the size simply. Yeah, so rather than, for example, the accessory pancreatic duct. And or it may be even, there will be even two different pathways, so they will not be merging, and they will not be connected to each other. That's also can be seen in the different types of anatomical variations. So, and particularly that important part is that physiologically, then when we do have simply the separation and the bigger accessory the part of the accessory type of the pancreatic duct, most commonly what you can see there is that the pancreatic secretions are more pancreatic secretions in this case are passing through the accessory pancreatic duct rather through the main pancreatic duct. That's really very, very interesting and fascinating, but that's how it works. Now, important thing, what is, just a second, let me check if I didn't forget anything to go through. Um, mhm. Okay. Okay, so here comes the portion of the vasculature and the innervation, as you can see particularly here. And the vasculature, I do believe you already have the idea about the vasculature, yes? Because from the information of the body systems tree, when we were talking about the abdominal blood supply and we were talking about the abdominal aorta, as you can see particularly here, I'm talking right now, sure, about the arterial type of a blood supply, yes? That's true, Nasim. Thank you so much. That the biggest part here comes from the splenic artery. That's true, because you remember that even in the body systems tree, we were saying that as the splenic artery passes, yes, towards the from the part of the celiac trunk. So simply starting with the beginning. So we have the abdominal aorta, and we do have, in the case of abdominal aorta, on its anterior surface, we do have three main type of the branches, which are unpaired anterior type of the branches. Yes, these are the celiac trunk, the superior mesenteric artery, and inferior mesenteric artery. Yes, so as a result, when we talk about particularly the portion of the pancreas, please remember that yes, mainly its blood supply is dependent on the portion of the celiac trunk. That's true, but still there is some contribution from a part of the SMA or superior mesenteric artery. Yes. And as our colleague Nasim told us, particularly here, she said that mainly it is the splenic artery, and this is the truth. The splenic artery is largest branch of the celiac trunk, as you remember, yes? And as we remember from a portion of a description that while a splenic artery passes towards the left side of the abdominal cavity to make to give a large amount of the branches, yes, and enter then towards the region of the spleen. That's why we call it the splenic artery. Yes, it gives rise to a large amount of different types of the branches. Yes, and as you can see, as it is passes closely to the part of a pancreas, particularly its body, as you can see here, as well as the portion of the tail, you can see that there are the multiple types, like up to sometimes even up to like 10, 12 branches of the splenic artery is literally originating and giving rise to the blood supply of the portion of the pancreas, particularly the body of the pancreas, some portion of the neck of the pancreas, as well as the part of the tail. Okay, so but from the side, because okay, it's on the left side, and it's clear and it's very logical that yes, splenic artery will be very much important in this case. But from the other side, we do have a head and a part of a neck. Yes, so the question is here then, what about the head and neck? So what is giving rise to the blood supply of it? And here back again, we are talking about the portion of the celiac trunk, but in this case, we are talking about the medium size, how do you call it, a branch of the celiac trunk, and this is particularly the common hepatic artery. That's what you can see here. But you remember that the common hepatic artery was giving rise to the different types of branches, yes? For example, hepatic artery proper, the ones which we'll also talk today about as a part of the liver, Yes, but also we had the portion of the gastroduodenal artery. Do you remember? So this gastroduodenal artery, which you can see particularly here, gives rise to the different types of the branches. And for example, you can see here this right gastroomental or gastroepiploic type of the artery and so on. But in this case, it was particularly for the blood supply of the stomach. Yeah. So particularly on its greater curvature. But in this case, you can see that we do have the formation of the pancreatico-duodenal arteries. So it's a short artery, which then starts to subdivide into the part of the anterior and the posterior regions. Although important here to remember is that pancreatico-duodenal arteries, we have two of them. One, as you see particularly here, comes from the gastroduodenal artery, so from the celiac trunk. Yes? But the second one is the pancreatico-duodenal artery, which is, by the way, the first branch of the superior mesenteric artery. That's what you can see here. Yes. And as a result, we call them differently. So we identify that the one which comes or which originates from the gastroduodenal one, as you can see where it is localized, simply superiorly. Yes, that's why we call it superior pancreatico-duodenal artery. Okay. So, and the one which is originating from the SMA, which is the how do you call it, superior mesenteric artery, that one is the one which is more inferior localized, as you can see, and that's what we call inferior pancreatico-duodenal artery. And then, as I said, these arteries are not that long. They are short one, and they start to subdivide. And they start to subdivide and pass on the anterior surface and the posterior surface of the pancreas and in the close proximity to the duodenum. As a result, we say that we do have anterior and posterior superior pancreatico-duodenal artery, as well as anterior and posterior inferior pancreatico-duodenal artery. And the most interesting thing that these two arteries, these two pairs of the arteries are making the anastomosis, and as a result producing this type like an arc or arcade, yes, which is then giving rise to a smaller branches and gives rise to the blood supply of a portion of the head, the neck of the pancreas, as well as the part of the descending duodenum. Till now, is it clear or not? Whew, that's good. Okay, and so this was particularly about the for what, Hina? I didn't understand. Sorry, I was clear. Okay, that's nice. I'm happy. I'm happy that it was really very clear. Well, so what I wanted to say here in this particular case is that okay, the part of the arterial blood supply is more or less clear for us. Yes. But what about the venous drainage in this case? And I do believe it's even more understandable, yeah? Because again, to just recall the information from the body systems 3, for example, yes? So what do we remember in this case? We remember that whatever part of the foregut, midgut, and hindgut we have, you know that they are dependent on the drainage mainly through the hepatic portal vein. Yes, so particularly this hepatic portal vein is the one which is draining the blood from all of these regions, as well as you see the accessory organs here, sure, and these are particularly the portion of the pancreas, and even the part of the spleen, as you remember, is also the portion very much dependent on the drainage from towards the hepatic portal vein. But the hepatic portal vein, as we remember, is mainly composed of merging of two parts. These are the superior mesenteric vein, as you remember, and the part of a splenic vein. Yes? So, and we said even that anatomically, this particular merging happens on the posterior surface of the neck of the pancreas. Yes? As a result, the drainage here will be through the portion of the pancreatic vein, a smaller vein, as you can see, which are draining towards the splenic vein, as you can see here. Yes, as well as in the case of the pancreatico-duodenal veins, which are superior and the inferior type of the pancreatico-duodenal veins, as it was in the case of the arteries. Yes, you remember that most commonly the veins have the same type of the name as it was in the case of the artery, which they are accompanying. Yeah. So as a result, the same idea is here. You do have the pancreatico-duodenal veins, which are draining towards the superior mesenteric artery. And as the result, you see that simply to say, the whole venous drainage of the pancreas is simply dependent on what? On the hepatic portal vein, mostly from the portion of the splenic vein. Okay? I do believe it's clear, yeah? And the last portion, what I want to talk here about, this is the part of the innervation. And then let's have some rest, 10 minutes, okay? And then I will continue with the part of the liver. So what do we have in this case in the part of innervation? As we've talked about these salivary glands, yes? Again, the same idea, all right? This is parasympathetic and the sympathetic innervation. I do believe it's clear. We don't need even to think about what will be the parasympathetic innervation in this case. Yes, we are talking about the vagus nerve simply, and the vagal nerve is the one which is giving rise to the innervation of the pancreas. But what about the portion of the sympathetic innervation? What do you remember? And here comes particularly the part of approximately. So these are particularly the part of the splanchnic nerves, as you know, and these splanchnic nerves are mainly taking their origin because you remember it's a sympathetic innervation, so it means that it takes its origin either from thoracic region or lumbar region. Yes, so in the case of the pancreas, the lumbar region is too low for the innervation, and as a result, somewhere from the part of the T5 to T9, that's where the part of the splanchnic nerve will take their origin and give rise to the innervation of our pancreas. Yeah, the next one is liver. Was it clear or not, guys? Good. Okay, let's have some rest now. Yes, 10 minutes. And particularly at 6, I will be back to you and we will continue. Okay?